decreasing any type of scar tissue. The inflammation you might have starts dissipating because you're not tight, you relax.
Yeah.
So I push the inflammation out, giving you more mobility and decrease your tension. First thing I do is I put on the Kyrospa anti-inflammatory. First, the spray for your joints. So he's got a lot of joint pain around the scapula area and his shoulder and the low back. So that's right. So I go all over his muscles. As you can see, this is more inflamed. Look at that. That area has a lump. That's inflammation. There you go. Keep breathing. Breathing out. Breathing out. I also put some cream on his feet. Why? Because since I do reflexology, it releases the tension on your feet. What is reflexology? There's certain points in your foot that coordinate with his back. So let me get on this side. Certain points in his foot, this area here is here. This area right through here is here. The toe, or just before the toe, is his neck. Alright. This is the arthrostim. What it is an instrument that changes the frequency of how your muscle fires. Example, if your muscle is tight, it's going to fire much faster. So what I do is I lower the frequency. As such, you can hear it, and it's a slow pace. Now, if you want it faster, then you hear it like this. What I like to do is just relax the patient. And we go vertebra by vertebra, and I ask him to breathe. What I'm doing is relaxing the muscles by taking pressure off the disc space. The disc separates each vertebra. And when there's disc compression, the vertebra gets closer and it compresses on the nerve, pinches on the nerve, and it causes the muscle to spasm. When the muscle spasms, it starts causing pain due to the inflammation, the body's defensive mechanism to protect itself. Do what we call posture. What we're going to do is change the frequency of the gun. I'm going to simulate a correct posture, one hand over the other, and he's going to bring his elbows in, and basically what we're going to do is change the way the muscle fires so he can have his chest out when I'm done. As you can see, he's been working out. His muscles are very defined. So his muscles are following the structure. As you notice, his elbows start coming in. Keep putting your elbows in. As I relax the middle part of his back, his elbows keep coming in. And I do it one more time. One more time. One more time. Yeah, I've been seeing him in 3 weeks. He needs a little bit more today. See how his elbows come closer together? We can release all the tension on his back, and then he relaxes. That's about it. And let go. So this moment, trigger point massage. What's important here is that we break up any scar tissue that the patient has. So we get more blood flowing to the all the way down to the calf. Now he's ready for the reflexology portion. Three patients carry their stress on their shoulders, so they get what you call knots. So this machine does a trigger point massage to try to alleviate and reduce the tension caused by those knots. Deep breath. And okay, so now what we're going to do is we're going to do the chiropractic adjustment. All we're going to do is just align the vertebrae to correct any subluxations or just deviations of the spine and allow the nervous system to work perfectly. Good. Again. What we're just doing is making sure the hip is in its right position. So you come here and the bone will go by itself. You see? By itself. The other side. As you can see, he really enjoys it. Nice and easy. Maybe more. That's it. You got it. Alright, so now what we're going to do is we're going to do the stretching and the strengthening of his back. So what you want to do is release the tension of the hamstring so you can take the pressure off the back. You do this, so you come up to the edge, please. There you go. Okay. So, he starts over here. That's as much stretch he could go. Well, we're going to take him 45. Right down here about. So we have this much to go. So I help him out with the machine. Breathe. Okay, deep breath and push. And let go. Again, deep breath and push. Excellent. So where did we start? We started here. Where are we? I want it to come here. Look at how far we've come. See, he was over here. We released the tension and look at where he's at. Bend your leg, cross right here. So now we're going to work these muscles. Again, the theory is that if you relax the muscles here, he's going to be able to go much further. And relax. That's it, just release. Go ahead, one more. And let go. Excellent. Now remember when we started, watch his leg. He's very happy. Alright, so we're going to do the last part of our stretch. This is an exercise you can do at home. Bring your legs to your chest. Okay, what we're trying to do is stretch all this area. He's very flexible. He's been under my care for 3 years. Okay, so what we're going to do is you're going to bring him over here. And what I like him to do is push up, straight up. So you're going to come here, hold, push up, and release. Push up, and release. And he's done. So now I'm going to sit him up here, and I'm going to adjust his shoulders. Now watch. Now his back is much more perfect. He came in like this. Now it's like this naturally. Okay? Perfect symmetry. Remember he had this inflammation, this area right here. It's not no longer there, we flushed it out. Well, what it is called the arthrostimulant. What it is we take the gun, it has a probe. The probe goes in between your vertebrae, and the gun has different frequencies. A fast frequency for muscles that are just weak. So we want to trigger more blood flow into there. A slower frequency, if your muscles are very, very tight and tense, you want to relax the muscle, and that's why we change the frequency. So this is for the adjustment, change the probe. This is for the massage or the trigger point massage to release any knots, inflammation, to increase blood flow into the area. So we use two different probes, one for the spine and one for the muscle.
Thank you very much.